Alex Normington with the Cook County Health and Hospital System. You can visit us online at cookcountyhhs.org. If you're ever in need of a physician, please call our Patient Support Center at 312-864-0200. I'm joined today with Dr. Mark Loafman, who is the Chair of Family Medicine and Community Medicine at the Cook County Health and Hospital System. Before we get into our questions, Dr. Loafman, can you tell us a little bit about family medicine?
Alex, thanks. It's great to be here. It's a pleasure to talk to our audience tonight, too. So family medicine, it's a primary care specialty. So family medicine is the specialty that takes care of the patient. We don't divide up by an organ system, so we have plenty of specialists, cardiologists, pulmonologists who take care of that organ, and we're often glad to have them. But we're the one who really takes care of the patient. So there isn't any problem that's not on our problem list. There's nothing that the patient would bring forward that we wouldn't want to help deal with. And studies show that about 90% of those problems can be managed in the family medicine office. The other thing is we really have a preventive health and wellness orientation. So we're wired up that we have specialty training to focus on prevention and wellness. So part of it is to kind of help manage problems before they become a specialty need and before they end up needing an acute care hospital scenario. So it's really almost like a general contractor we think about, sort of kind of keep an eye on the whole system, manage the whole system, and really take care of you as a patient. And the last thing I think that's really important for people to know is, families are systems, and to have a doctor who takes care of the whole family. Family doctors are the only ones who can see both the adult and the child, often in the same visit, which is super convenient to be able to do. And I think sometimes there's a misconception that we are not specially trained for the depth needed, but that's what our specialty colleagues are for. So again, family medicine was something, a calling for me. I found it in med school. The thing I love about it is the relationships we get to build with our patients over time. I've been doing this long enough now that I have 24, 25-year-old patients who I delivered a long time ago, and I'm the only physician that they've known, or at least my practice is the only physician they know. So it's a very special relationship. So if you don't have a family doctor, get one. We'd recommend you do it. I think you'd be happy with that relationship.
It's kind of disheartening to know that about 20% of people never see a physician in a calendar year. Why is it important for people to see their doctor on a regular basis?
Yeah, it's funny when you think about it, and part of that's got to be on us that we haven't shown the value that you would say you want to come and see us. But we think about, look at our automobiles and our home heating systems and things like that, where we absolutely are going to get those checked out. You don't want your car to crash on the road because you didn't do preventive maintenance. So we often talk about, for our bodies we have an owner's manual. We should have one. We don't. That has that maintenance checkup and those regular check-ins. But I think that's really a good way to think about it. So when you're going more than a year without checking in, there's probably some preventive maintenance, some screening, some counseling that you need to have and would benefit from having that might prevent you from crashing on the road someday for lack of preventive maintenance. And if as physicians we're not making that clear to you, we're not demonstrating that value, then shop around and talk to your doctor about that. Why should I come in? What's the value of this? We need to make it worthwhile. But I think that's the way to look at it. You should have kind of that owner's manual for your body and your family's body, and what's the best way to keep an eye on that and maintain it. Preventive medicine, not waiting until something's broken and go in and fix it, but kind of keep an eye on it up front.
Absolutely, and a lot of people are probably familiar with our health system. We have two hospitals, Stroger Hospital and Provident Hospital, but we also have more than a dozen health centers that are throughout the community. So again, if you're interested in making an appointment, you can call 312-864-0200, and we can connect you with a doctor like Dr. Loafman and get you for some of that preventive maintenance. So one thing that we all have to be concerned about given the time of year is influenza. The fall is the start of the flu season. Are we expecting a bad flu season this year, Dr. Loafman?
Hard to know, but it's coming. I mean, we never know how many we get until it's over, the year's over. But this year should be about like the last couple of years. And, it's a preventable illness. So, we somehow 20 years ago kind of got off track in this country with flu, thinking that flu vaccine and flu prevention was different than all the other very successful vaccine programs we have. So we're worried about flu this year like we are every year. We lose about 200 children to flu every year. We lose thousands of adults to flu every year. We assume this year it's going to be the same. And most every one of those deaths is preventable. A lot of the loss of work time and hospitalization for pneumonias and heart attacks that happen because of flu, all preventable. So on our side, looking at this from a public health approach, it's just devastating to see the preventable illness that happens every single year because we're not taking these steps. So yeah, we're assuming it's going to be another bad year, and we're hoping we can get the word out to get people to prevent this time. Maybe this could be the best year for prevention ever. That's what we hope.
Always. What can people do to prevent the flu?
Yeah, protecting yourself from the flu, preventing it, there's really three big strategies. The first one is to get the flu vaccine. So, that's the thing. And if everybody got it, who should get it? Everybody should get it, that's for sure. It's going to happen, and we probably should talk a little bit more about that. So get the vaccine. The other is just don't get infected by people, and so don't spread it if you have it, and don't get it from people who have it. And there's some I think, newer thinking about how to protect that. So cover your cough is an important one we talk about. And I think we all grew up sort of cover your cough like this, which means that flu is in your hand and everything you touch. So we've learned to cover the cough with your arm or sleeve or with a tissue that you can throw away. So it's so silly, but it's good basic behavior to cover your cough and not with your hand and spread it around. So that's where the secretions come.
And
So,
Dr. Loafman,
yeah.
I'm sorry to interrupt, but it looks like we have a caller.
Well, I'd love to hear from somebody. Yeah.
Excellent. Caller, go ahead with your question, please. Oh, it looks like we lost them.
Oh,
Back to flu prevention.
yeah.
Cover your cough.
So,
elbow use?
Cough in the elbow, cough in a tissue if you have one that you can throw away, not a hanky that you're going to continue to go back and forth. But don't cough in the hand. I think that problem is then the virus is in the hand, and that's what we worry about. So, don't spread it that way. We kind of learned to not touch our mucous membranes, so our hands tend to touch surfaces that other people have touched who have the flu. And hand to face, eyes, mouth, that's the most common way that flu is spread. So it's just a good idea anytime, but especially in flu season, to not touch those parts of your body. So keeping that hand hygiene, washing your hands often, using the hand gels often, those things are very, very helpful. We do that in hospitals and clinics routinely. We gel before we go in, we gel before we come out, because we don't want to spread that flu. So.
All right, looks like we have another caller. Caller, go ahead.
Hi,
Hi.
can you tell me about children and sugar intake?
Absolutely, yeah. There's been a lot of press about that, especially in our county, about sugary drinks, and we had a big campaign about that. And there was a lot of good information out about it. There was some misinformation, and we want to clarify that a little bit. So, I think the health effects of sugar are very significant. We really, really worry about it. We didn't know about this for some time, but the more we learn, the more concerned we are. And I think a lot of us think that sugar is just a dangerous substance for our kids to have, and that sounds strong. It sounds like a strong statement, but there's a lot of reasons why that's true. I think sugar creates craving for more sugar, so it just creates that. There is a little bit of a psychological buzz that happens with sugar, so it creates some sort of addiction almost concept about it. So I think we know for people who are used to having a sugary drink at mealtime or as a snack, how powerful the craving is to have it, how unsatisfying a meal is unless you have that sugary drink. So it really would be better if kids kind of grew up without developing that kind of addictive craving that actually has a lot of health consequences to it. So we really hate to demonize an industry. I mean, there's, the software drink makers and the sugar manufacturers. I'm sorry for them. It's really unfortunate that this has happened. But we know now how serious of a health issue this is when we look at obesity trends, when we look at some of the health effects and the suffering that Americans have that other countries don't have. A lot of this is related, not directly all caused by, but there's such a strong relationship with something that's completely avoidable. There's simply no reason to have sugary drinks. So raising children, when we learned this in our family, it just became off the table. It's out of the refrigerator. We just don't do it. And what we learn with our own kids is that they just sort of lost a taste for it. It takes a few weeks, maybe a few months. You sort of lose a taste for it, and you can get by with a meal with water. You can get by with a snack time with water. Unsweetened tea and some other healthy beverages. So sugar, avoiding it, not just in the drinks, but also in food items. It's the raw sugar, the processed sugar that seems to be particularly bad. There are many alternatives about it. So read credible sources about it. Don't just take my word for it. There's a lot of credible sources. There's some junk science out there too. But I think, CDC, there's many websites that have good information about it and really become familiar. It's a really important topic. And I'm glad you asked the question because I think it's one of the easiest things we can do to help the health of our children is to help them not grow up learning to sort of have an addictive craving for sugary, snacky foods and drinks at mealtime. So great question.
The CDC says that having one soda a day can increase your risk for obesity or diabetes by up to 25%.
Yeah, so why do it? I mean, that's the thing. So, it's a little bit okay, maybe not. A 25% increase in the risk of diabetes. So, I think what that study points to is the additive effect and the kind of addictive effect that these drinks have. And again, don't take my word for it. Talk to people who just can't get through a meal without having a sugary drink or can't, get ready for bed. And then whatever the time it is, they're just really dependent on that. It's a craving. The good news is it does extinguish. So once you stop having them, you're able to kind of extinguish that craving for that. But that would be a good goal, just to step away from it and try for a while and see. Sometimes weight begins to come down a little bit just with stopping. Other health behaviors begin to improve by stopping. So, the alarm that I think people are hearing about this and the concern about it, it is science, it is evidence-based, and some of it's a relationship. We can't always say cause and effect, but the relationship is clearly there. And again, this is something that's so easily avoidable that we should make healthy steps to avoid it.
Now, we've been trying to raise awareness about diabetes, too, and diabetes and sugar are very much linked. And as a practitioner, are you seeing not only adults but children more increasingly at risk for diabetes?
Absolutely. It's like an epidemic that, every year we're seeing more people diagnosed and younger ages diagnosed with diabetes. So, and diabetes, it's lifestyle related. So it's a genetic condition. Some people are predisposed to have it. Some people almost will just never develop it. So for those who do, though, you want to be able to manage it and prevent it. So that's right.
And we've got a caller on the
Okay.
line. Caller, go ahead with your question.
Hi, this is Diego. I live in Pilsen, and my parents don't speak English, and I'm always worried about taking them to a clinic or hospital and make sure that they are able to get the treatments that they need in a culturally appropriate way. What do you guys do in your system?
It's a great question, and it is a challenge. We're a multicultural city. Great thing about the Chicago area, it's such a multicultural city, many languages spoken. But, kind of the earlier comment Alex asked me about family medicine, all physicians, how effective can we be if we don't communicate? So it's a commitment that we have to be able to do it. Building capacity to do that's important, but it's kind of a standard of care that we are able to communicate in the patient's language. As much as possible, that means that our providers and our staff speak Spanish language is such a thriving important part of our service area here in Chicago that we're increasingly able to provide that directly available by the provider and staff themselves speaking Spanish. We have some of our clinics where all of the staff are fluent in Spanish. If it's a language other than Spanish or it happens to involve one of our other sites or specialty centers, we sometimes have to use a live interpreter on the site. And Spanish is something we have capacity to have live interpreters when needed in our sites that might not have as much depth with Spanish language. And then we have a couple of levels of backup too. So we have language lines 24/7 with, I don't think there's a language that exists that we can't find an operator for who can assist us in that translation. So there's something available, and again, it's a standard of care for us that we communicate with the patient in the language of their choice and preference. So, but Spanish, again, we're really building capacity for that. We have some great community health centers in your community that would be there that's multiply fluent and well fluent in Spanish language. So thank you for the question.
Yeah, and I know that the doctors and nurses and all the staff at the Cook County Health and Hospital System want to make sure that everyone feels welcome, whether regardless of your insurance status, immigration status, the language you speak, religion, you're welcome here.
Great.
So Dr. Loafman, before we look into the second half of our show, I wanted to talk a little bit more about diabetes. Can you tell us what symptoms or warning signs people should look out for?
Yeah, well, again, part of that idea of going in for the regular maintenance, so we've kind of learned who the risk factors are, so we do annual screening, and diabetes doesn't just show up overnight, it sort of builds up over time. So we'll find we can detect levels in the blood of elevated blood sugar, what we call insulin resistance, that insulin is no longer working that well in the body. So doing those screenings would be important.
Excellent. And we've got another caller on the line. Please go ahead.
Yes, and good evening, and thank you for taking the call. I know you're not an endo, but can you please tell me, why is it now so many children are being born and they having diabetes? What is it going on?
You know, it's a very
And
good question, and
you didn't never see nobody as when I'm older guy. We didn't see that many people growing up with diabetes. So let me get out there so I can hear your response. And thanks for taking the call.
no, it's a very insightful question, and it's one that a lot of epidemiology is being looking at, sort of the study of disease across populations. So, and again, there's these associations, so I don't think we can say 100% this is the cause of it, but the associations are so strong and science-based that I think we know they're there. So the major issue is one of obesity, of size and growth, and then the way in which we develop the obesity. So I think, again, diabetes, the genetic predisposition is there. And there are some populations who have a lot higher prevalence. The history of that goes back to, kind of populations where there's been famine and the ability to hoard carbohydrates. There's a lot of anthropology that's fascinating about that, why some populations, particularly minority populations, have more diabetes than others. And it's not their fault. It's not a bad lifestyle for that genetic predisposition. It's really an evolutionary habit or pattern that's developed. But once that predisposition is there, what turns on the expression of the diabetes? So what's going to cause you to then have elevated blood sugars? And that's where lifestyle plays a huge role. So obesity triggers that predisposition and causes people to have the symptoms of diabetes, which means the blood sugar elevates. Insulin, the body makes, no longer works effectively. So it's that type 2, what we used to call adult onset diabetes, that we're now seeing more, and I've diagnosed it in 10 and 11-year-olds in my practice who have adult onset diabetes. So we don't really call it that so much anymore. It's type 2 diabetes that we're talking about. So it's the genetic predisposition and then the lifestyle issues that expose it to have it come out. So being leaner, having a lower carbohydrate, less sugary diet, a lower glycemic diet or glucose diet, that's going to delay the expression of it, and in some cases can actually prevent the expression of it. So it really has to do with a combination of who we are as a people, what we eat, and then how early we're developing obesity traits in this country. That's the connection that's very strong, and I don't think anybody can dispute that.
So if a child comes into your practice and has early warning signs or full-on diabetes, what do you recommend for them?
Yeah, well, we used to kind of say don't lose weight as a child, but we've actually started talking about there are some children who could lose weight, but we're really talking about sort of growing into their weight. So as the height continues and you don't gain weight, you're going to grow into a healthier weight. So that's kind of what we're talking about is slowing down the acceleration, slowing down the rate at which children gain weight, and let them grow into the weight that they have as a healthier weight. And that's a good goal. And that really becomes by consuming less calories and burning more calories as well. So it's lifestyle, so it's diet and activity. And again, it sounds like a broken record, but the simplest thing to do to lessen the wrong calories that kids are consuming is the sugar that kids get in their diet. And when we do a dietary history, and we always do that as part of this assessment, sometimes it's amazing that 1,000, 2,000, 3,000 calories a day are being consumed in sugary beverages and sugary snacks. Empty calories that cause a little bit of this craving and addictive buzz that kids get, and again, part of this, the liver fattens, insulin stops working as well. So those are the easy things to talk about, hard things to implement, but easy things to talk about. So that's really the way we want to go, is we want to begin to look at lifestyle. And it's not shaming or blaming, it's nobody's fault that this happens, but we think with education and information, people can make some changes. And I would also add, we really try to avoid, if it maybe one of the kids in particular is having the issue, we don't want to fat shame and blame that child. So it's really the whole family can adopt these healthy lifestyles together, walk together, exercise together, get the sugary drinks completely out of the house, off the table. Everybody will benefit from it, and it's just because the one child may be suffering more from it. There's genetic predispositions to that and other factors that may cause it for that one child. Make it a family issue to kind of get help for that.
So in addition of taking care of families, you also see women who are expecting and
Yes.
see them through their pregnancy.
Yes.
So what are some of the key tips that you have for women who are pregnant or looking to become pregnant?
Yeah, a great question. I think, the more we learn, the more we realize that once a pregnancy occurs, a lot of the outcomes are sort of hardwired. So preconception, we call it, before pregnancy, counseling and screening is really important. And for some women, there's not a whole lot. They're doing all the right things. It's very reassuring to know that. But for others, there are some testing, some screening, some lifestyle changes that could happen that would make pregnancy safer when it is desired. So I think, family planning is one of the most wonderful, sort of liberating things that I think is happening for women and for our country. So I think for people to have access to family planning, and by family planning, we don't just mean birth control, we mean planning when families are going to happen and when we're going to pursue pregnancy. So having a relationship with your primary care provider, women's health provider about that, talking about that, having a preconception visit, planning how that's going to happen, and are there things that can take place ahead of time and some screening so that pregnancy can occur in a healthier way. And then once pregnancy is happening or beginning to happen, kind of an early access. And I would say we didn't used to be as good about that. We kind of wanted women to get through that first trimester and know that it was going to be a retained pregnancy before we started prenatal care, but we're getting a lot better about an early visit, not to establish prenatal care, but really just to assess where the patient is and planning that. So in the context of her goals and then a family that's there as well.
Excellent. And so you also deliver babies,
I
right?
delivered a lot of
All the way
babies
through.
in my career, absolutely right. So my role as department chair now at county and all the things we're doing, not so much right now. I have colleagues who have helped me more with that, but I lost count at about 1,500 deliveries years and years
Oh my
ago.
goodness.
It's something that was part of my practice. I did some extra training and to do that. But and again, I have patients that are in their 20s that I had the privilege of taking care of their mothers prenatally and delivering them, and I've had some second generation deliveries too, which is awesome. So
That's
yeah,
fantastic.
to be able to do that, yeah. Great.
So, as you mentioned, you joined the health system a couple years ago. There's been a lot going on. What has been the most remarkable to you in terms of the plans that we've put forth for patients?
So I had the privilege of training some at Cook County when I was a Rush medical student a long time ago, and in the old Cook County system. And it's always been known for what I like to call rescue cares. When people are sick and in trouble, I don't know any place better than to be able to be rescued and taken care of than Cook County. But I think what's been awesome in this last several years in particular is what we call a public health approach. So thinking about how can we help people not need to be rescued? How can we get ahead of that a little bit? So I think the move to the community setting, to move into primary care, to having our specialties be more accessible in an earlier stage of the illness, those are things that are exciting. And it was, to me, so exciting that I really was happy to be able to come and join and bring my experience to the county system and to help and to learn from all the things that are going on there. So I think this, some people call it population health, it's public health, it's really thinking about the population of patients who the Cook County Health System serves and how our Cook County Medical Group begins to really think about that group and begin to work with them. So I think that's the exciting part about it, and being able to be all on the same page. The health department is involved. Our whole executive team are involved, our kind of research efforts and our training programs. There's world-class training that goes on at the county. And having that lined up around this idea that we're really not so much about focusing on just waiting till people are broken and injured and rescue them. We do that, of course, and always will. But we're also now thinking about how to get ahead of that, to go out in the community and meet people where they are. And even thinking about some of the social determinants, some things like jobs and housing and food security. All these things are fundamental to wellness and being able to get ahead of that. It's amazing to me. It was too good of an opportunity to pass up, and I'm just really happy to be part of the system.
Oh, excellent. That's great. And so that goes back to the relationship with your primary care provider. So I know we mentioned this at the top of the show, but if you are in need of finding a doctor, we can help you out with an appointment, 312-864-0200. Dr. Loafman, it's just been a pleasure having you on today. Thanks so much for sharing your insight.
Great. I enjoyed it, and thanks callers for the questions. They were great.
Indeed.